inhibit the reuptake of catecholamines, including the very potent alpha-1 agonist, norepinephrine. This can trigger vasospasm within the coronary arteries. Sumatriptan and ergoalkaloids are drugs used in the treatment of migraines. The pathophysiology behind migraines is complex, but one of the components is that the cerebral and meningeal vessels are excessively dilated. So someone really smart discovered that blood vessels have serotonin receptors. And when activated by serotonin or serotonin receptor agonists, like sumatriptan or ergoalkaloids, these vessels vasoconstrict in order to alleviate pain. Now, that's awesome for our migraine, but not so awesome if this occurs in our coronary arteries. That's right, this is how these drugs put you at risk for coronary artery vasospasm. Now, coronary artery vasospasm presents as ST segment elevation. If a patient has been partying all night and comes in talking fast about his or her chest pain, you should think cocaine. Alternatively, think about sumatriptan in a woman with a history of migraines presenting with new chest pain. Adenosine, niacin, calcium channel blockers, and nitrates are all vasodilators. Dilating vessels in the dermis can lead to cutaneous flushing. Question: what can be administered to a patient to prevent the flushing from niacin? An NSAID can be used because niacin indirectly causes an increase of prostaglandins that lead to the flushing effect. Vancomycin is famous for causing red man syndrome. This happens because vancomycin induces histamine released from basophils and mast cells. We usually give an antihistamine like diphenhydramine and slow the rate of infusion to prevent this. Echinocandins can also induce histamine release, but it's super rare and there are more important side effects of these type of drugs. Anthracyclines, such as doxorubicin and daunorubicin, are chemo drugs that create DNA damage by not only intercalating DNA, but by also reacting with iron to form reactive oxygen species via the Fenton reaction. How do you think the chelating agent dexroroxane helps prevent the risk of dilated cardiomyopathy? It is a chelator, so it binds to the free iron within cardiac myocytes to decrease the availability of free iron that might have a chance to react with doxo or daunorubicin. Torsades is a polymorphic ventricular tachycardia that shows up as a ribbon-like EKG. This can occur in patients with prolonged QT intervals or abnormal phase 3 repolarization. All of these drugs have one thing in common. They can compete with potassium at potassium channels during phase 3 repolarization. This prevents the efflux of potassium and can lead to prolongation of the QT interval, because more time is now required for potassium